The Service Detail Report, as the name of the report implies, is a detailed listing of service or treatment items provided within a defined date range. Each row of the report is a single treatment item entered in titanium and includes all the details of the treatment, such as the provider code, tooth number, course of care it was provided in, visit setting, etc. The report also provides all the client demographics with each of the treatment items, making it quite a versatile report for data people at your agency to get a whole range of information about the type of clients accessing your service and the type of treatments they are receiving. One main use of the Service Detail Report is in treatment audits, the most common one being the antimicrobial stewardship audit, where you can with this report produce a listing of all the 927 item codes so that you can audit a sample for each provider. The Service Detail Report is accessible under the Productivity Reports group of the Titanium Reports menu, as shown here. The available filters for running the Service Detail Report are as follows. Firstly, your agency's password code needs to be entered in the Agency Code field, as described in the report's overview video. The start and end date defines the reporting period, where the report generated will provide a list of treatments that have a completion date within the report date range. The item code type drop-down list defines whether the Service Detail Report is to be filtered to a particular group of items. The filter is similar to the one in the Service Mix Report. The options to choose from include State MPA, which filters the Service Detail Report to the standard 3-digit valid service items that are funded under state funding via DHSV, such as 011, 012, etc. Choosing CDBS will generate a list of treatments that are under the Child Dental Benefit Schedule, which are the 5-digit item codes beginning with 88 that are funded by Medicare. Choosing the State MPA and CDBS option will produce a Service Detail Report for both the state-funded 3-digit items and the Medicare-funded 5-digit CDBS items. Choosing all item codes will produce a Service Detail Report for all the valid 3-digit and 5-digit numeric item codes, as well as the invalid codes that are mostly alphabetic codes, many of which are added locally at your agency. The item code filter allows you to produce a Service Detail Report filtered to just one item code. This would commonly be used, for example, in the antimicrobial stewardship audit, where the item code 927 is simply typed into the field. Note, if using this field, you must have the item code drop-down list set to all item codes. Otherwise, a blank report may result. Also, with the item code field, you cannot enter multiple items in that field. If wanting to do this, then you should run the report filtering to the first item and then run it again filtering to the next item you are wanting the detail for. Noting, the Service Detail Report is quick to run. A Medicare number field has been included with this report to facilitate reconciling of Medicare benefit payments from the Health Professional Online Service or HPOS report. With that report identifying clients by their Medicare number, you can use the Service Detail Report to list all of the child dental benefit items that have been entered in titanium under that Medicare number. In most instances when generating the Service Detail Report, a large report containing many thousands of rows will be produced. For that reason, it is certainly not recommended to print the report. It should always be exported. For most of the export reports, Excel is the standard option to select, but as the Service Detail Report is a large report, we recommend it be exported to CSV. The CSV file created will open into Excel, and you will find it easier to view and manipulate compared with exporting a large report directly to Excel. A sample of the Service Detail Report is displayed here. As indicated before, the service detail report provides a listing of the treatments entered within a certain date range, so that each row is a single treatment item. Details of the treatment, including the completion date, course of care number, type it was provided under, provider code, tooth number, visit setting for the visit treatment was provided under, and the clinic it was provided from. The client demographics are also included, which includes just about all of the items entered for the client under the main patient details tab of Titanium. Note, as each row is a single treatment item, and most clients have multiple treatment items, the demographic information will be repeated over multiple rows. Over to the far right, the report also provides the next appointment date, which indicates whether the client has a future appointment on or after the date the service detail report is generated. If there is no date visible, it means the client does not have a future appointment in Titanium. The service detail report is a highly useful report giving you good access to your Titanium data. We recommend you highlight to any data personnel at your agency the availability of this report and suggest providing a full dump of the service detail data on an annual or quarterly basis.